Thank you. Dr. Peters, you're now recognized.
Thank you. Mr. Chairman, Mr. Vice Chairman, and honorable members of the subcommittee, thank you for the opportunity to testify about how we can create incentives to better prevent and treat chronic disease. I'm Dr. Ann Peters, Professor of Medicine, Clinical Medicine at the University of Southern California and Senior Scholar at the USC Schaefer Institute. The views I express are my own. Chronic diseases are a growing health and economic burden. By 2030, cumulative chronic disease costs could reach $42 trillion. This staggering figure underscores the urgent need for our shift in our approach to healthcare. As a diabetes specialist, I've spent my life devoted to preventing disease and its complications. I've written papers, books, and guidelines to help others understand the need for preventive health care. Lifestyle modifications, newer medications, and wearable technologies can help reduce the risk for diabetes. But access is disparate and largely dependent on socioeconomic factors. Most primary care providers don't have the time or tools to help people achieve sustained lifestyle change. Our healthcare system understandably pays surgeons a premium for performing heart surgery or removing a leg, but doctors like me don't get paid much for preventing cardiovascular disease or an amputation. The misalignment of priorities is at the core of our chronic disease crisis. I've treated many thousands of patients, some in affluent Beverly Hills and some in underserved East Los Angeles. The disparity in outcomes is stark and heartbreaking. My Beverly Hills patients live to become really healthy 80 and 90-year-olds. I can't remember when my last patient from this community lost their vision, had an amputation, or started on dialysis. Almost none have heart attacks or strokes. But in East LA, I see patients every week in their 20s and 30s who have developed life-altering, preventable diabetes complications, blindness, kidney failure, the loss of a limb. These patients rarely live to grow old. What is especially heartbreaking is that this is preventable. Our research has shown that if we provide these patients the resources they need, we can improve their outcomes. Everyone benefits from preventive health care. The data support that prevention is worth our investment. Schaefer research predicts that the social return on investment from treating adults with moderate obesity is more than 15% per year. Recent scientific advances suggest it may be possible to slow the aging process and delay the onset of chronic diseases. This approach could extend healthy lifespans and compress illness into a shorter period at the end of life. Interventions include new therapies for neurodegenerative diseases and addiction, medications to reduce cardiovascular risk factors, integration of wearable technologies, and blood-based cancer screening. Even moderate success in delaying aging could yield enormous benefits. One analysis found that by slowing aging by just 2.2 years could reduce the incidence of major diseases by 7 to 12% and save over $7 trillion in healthcare costs over 50 years. To realize these benefits, we need policy changes that incentivize prevention and health. Some of our recommendations include reimbursing physicians for patient outcomes, encouraging multi-year insurance contracts, ensuring innovators are paid a reasonable rate of return, and implementing value-based reimbursement models. In conclusion, the challenges posed by chronic diseases are immense, but so is the opportunity before us. With strategic investments and policy changes, we can usher in a new era of health and longevity for all Americans. We need to remove existing barriers and change our priorities, but there's no one-size-fits-all approach to achieving long-term, sustained behavior change. Systems need to be flexible and responsive to individual needs. My experience is that it can be done in nearly all clinical settings with the right resources, education, and dedication. Thank you for your attention to this critical issue.